Okay. Hi, this is Julia Tipton Hogan, the Executive Director of the Indiana Perinatal Network. Welcome to the second webinar of the Indiana Perinatal Network Hot Topics series. And we'd like to thank our sponsor, the law firm of Hall Render, Killian, Heath, and Lyman, who is our, who is our sponsor. Today, we are going to hear from Sacred Roots Birth Center, which opened in its current location in September of 2016 and had its first birth in early November of 2016. From Sacred Roots, today's speaker will be Angela Little, who is a certified nurse midwife. Who is also a 2012 Frontier Nursing University graduate. She completed her undergraduate nursing degree at Indiana University, Purdue University in 2003. Since completing her master's degree, Angela has worked for a hospital-based midwifery practice, providing care for an at-risk population in inner-city Indianapolis. Prior to midwifery, Angela worked as a labor and delivery and postpartum nurse for 8 years in both Fort Wayne and inner-city Indianapolis. Now we will hear from Angela Little. You can go right ahead.
All right, great. Let me get my slide to pop up there. There we go. Okay, hello everyone. Thanks for being here today. So as Julia mentioned, I am Angela Lytle. I am one of the owners of Sacred Roots Midwifery and Birth Center. And so I'm just going to talk a little bit about both, well, it'll touch on the midwifery model of care, the birth center model of care, and also our practice here at Sacred Roots. And then we will have time at the end for questions as well. So, you know, save those up and we can talk about all of those at the end. So here is just a picture of the outside of our building. We are Central Indiana's only freestanding birth center. It's about 2.5 hours to get to another freestanding birth center. And there are 4 more birth centers in the northern part of Indiana. There are not any in southern Indiana. We are nurse midwife owned and operated. We are on the west side of Indianapolis, right at 38th Street and I-465. There's a medical office park, and that's where we're located. And we are a community-based practice. Let me see. Okay, oops, I'm so sorry. Skip that. So you can read our mission statement there, but we provide exceptional nurse midwifery care here, supporting women and their families toward optimal health and empowered birth in Central Indiana's only freestanding birth center. So we are not only woman-centered, but family-centered. We work with the wellness model, pursuing empowerment of women and families, and within the birth center model as well. Speaking to that empowerment piece, we'll talk a little bit more about what our program of care looks like, but we do really believe that our model of care is achieves empowerment with women and families because we really believe in shared decision making, and so that is working with women and families to help them make the best decisions for themselves and for their families. And you know, when women are able to, and families are able to come to those conclusions themselves about what's important for themselves and for their health care, they are, you know, that's one small step of making important decisions in their lives. And then, you know, that goes on to making families in their decisions in their families' lives, and then decisions within their community. And we believe there's a lot of growth opportunity within our model of care. So our promise to our clients, unhurried appointments. We spend a lot of time with our clients nurturing prenatal visits. We always want to make sure that our clients have time and opportunity to have all of their questions answered. Definitely a balance of complementary and conventional medicine. So as nurse midwives, we are certainly trained within the more of the conventional medicine. model of care. We spend a lot of time, learning pharmacologic care and medical management, but we also really balance that with other complementary services and healthcare. So whether that's diet or chiropractics or using herbs at appropriate times, those are all things that we bring into our practice. Birth at the birth center is attended by a nurse midwife. Care is always individualized. What is important to each one of our clients, it varies, and so we are really able to provide that individualized care, speak to each woman about what lab tests are recommended, and really providing an individualized experience for every woman. And then of course we always want to be very safe. So the baseline of what do we believe? We believe that pregnancy, birth, postpartum, breastfeeding are all really normal, natural processes in a woman's life. We believe that birth center birth is a safe option for healthy women and who have low-risk pregnancies, and that it's optimal to have minimal to no interventions when we're talking about, again, normal healthy women with low-risk pregnancies. We believe in evidence-based practice, again, that empowerment piece, and that midwives matter. And the care that we provide does really make a difference. So here we are. So that's our nurse midwives here at Sacred Roots are me, Angela Lytle. Victoria Floyd is on the right, and then Christina Graham is in the middle. We just took this one evening when we were all together, so I was looking at this picture and going, wow, we have a lot of patterns happening there, but at least you can see who we are. So you already got introduced to me, so I think everything was pretty much covered. I started as actually when I was a nursing student, I worked in postpartum. So I worked postpartum as a nursing student and then went directly into labor and delivery nursing. That was at Parkview in Fort Wayne, Indiana. And then I began working at Wishart downtown and worked weekends there, and actually commuted from Fort Wayne to Wishart for 5 years and did that while I was going to Frontier Nursing University to pursue my master's degree. So graduated in 2012. I was able to do my midwifery clinicals I did with Auburn OBGYN, and so had the opportunity to learn both in their birth center and in the hospital setting. And then took a position here in Indianapolis after I graduated, full scope midwifery. And first 2 years I worked both in the clinic and the hospital. In my third year with that practice, I worked as a hospitalist. So I caught a lot of babies that third year. And then during that time, Victoria and I were working together to build the birth center. So we are very excited to be here. It was a long road, and we're happy with where we're at. So this is Victoria. So Victoria actually started out as a direct entry midwife. She lived in Kentucky and worked as a direct entry midwife in Kentucky for 8 years, and then moved back to Indiana and discovered at that point that it was a felony in Indiana to be a direct entry midwife. So she made the decision to go back to nursing school. And so she worked 7 years as a certified pediatric nurse at Riley Children's Hospital, and then also went to Frontier Nursing University to get her master's degree. And when she graduated, she started a home birth practice. That practice was Carmel Midwifery and Women's Health, so you may have heard of that. And then, so then ended that practice as we started Sacred Roots Midwifery. And Victoria is also an herbalist, so that's something that she's able to bring in to our clients who have interest in complementary herbal medicine as well. And so it's the two of us that own this practice together. And then Christina just recently joined us, and we are thrilled to have her. So she has over 8 years experience as a nurse midwife, and currently is working in an administrative role with a local hospital. She speaks Spanish fluently, and we are so excited to have her joining our team. She's also helping us cover vacations, so Victoria and I are thrilled that we might be able to go on vacation every now and then. So there's a lot of confusion about midwives. Just in general, I think there are a lot of different types of midwives and different educational paths for different midwives. So you hear a lot of different terminology, you know, direct entry midwife, certified professional midwife, nurse midwife, but I'm just going to speak specifically to nurse midwife today. But nurse midwives are advanced practice nurses, so we are registered nurses, and then we have a master's degree in nurse midwifery. And we are nationally certified by the American Midwifery Certification Board, so it is a national certification. And then we're also licensed by the state. So nurse midwives can be licensed. There is licensure for nurse midwives in every state in the United States, and also midwives can prescribe in every state in the United States. So it's going to look a little bit different in every state because every state has their own licensing board and as far as what their requirements are. But so in Indiana, our licenses are a license as a registered nurse, a license as a certified nurse midwife. We have a license for prescriptive authority. And then we also have a license for controlled substance registry, and then not mentioned on here, also a DEA license to be able to prescribe. So that's a national license, of course. We are independent practitioners, and we do offer full scope women's health care. So I think a lot of times we're only thought of in terms of pregnancy and birth, but we, you know, take care of women throughout the life cycle. So we definitely see teenagers, we see women for well woman visits, we do contraceptive care, we do problem GYN visits. So definitely seeing clients in our care for much more than just pregnancy and birth and postpartum. So the midwifery model of care, again, coming from a wellness model. So a lot of preventative care. And then we are definitely woman-centered, a holistic model of care. So seeing a woman more than a pathology, for sure. So seeing a woman as herself and her position in her family and her position in her community. Again, coming back to the shared decision making that I mentioned earlier. So we recognize that women come to us with their own level of knowledge. And so we want to add into that knowledge that they have or fill in any gaps. Or we do a lot of, you know, when it comes to that shared decision making, talking through options and making sure that women have the resources that they need to make the decisions that are best for themselves and their families. Certainly bringing in evidence and making our recommendations according to evidence. And then going to go a little more into the time-intensive care that we offer and specifically how that compares to typical medical model of care. So this is a chart that we created just kind of reflecting our own practice, but looking at the amount of time that we are typically spending with our clients. Again, these are all averages versus what might be seen in most medical practices. So of course there's variation in terms of when women first come into prenatal care, but just using 10 weeks as an average. So our first prenatal visit with our clients is a 90-minute visit. So that really gives us a lot of time to sit down with our clients, get to know them, they get to know us, also making sure we're doing a thorough medical history at that point, making sure that there's plenty of time again to ask questions. We do an orientation typically prior to women coming into our care. So they've already had an orientation session, but certainly there's even more information to be oriented to, especially for women choosing out of hospital birth. So, and then in a typical medical practice, that first visit with a provider may be about 30 minutes. And then most of the time in medical practices, and of course this is all typical, but most providers have 15-minute follow-up visits. We actually, and this isn't even correct, we've even changed this. Our second prenatal visit is now a 60-minute visit. So at the second visit, at 36 weeks, we do 60-minute visits, and then all other prenatal visits are 30-minute visits. So we're going to go into a little more as far as what birth looks like, but we are with our clients throughout their entire active labor. So we're not just coming in to catch the baby and leave. So that's quite a bit of time that we are spending with our clients during the birth. So you can see this is, 360 minutes is about a 6-hour labor. So that's a fairly quick labor. Certainly women who have had babies before sometimes have a faster labor than that, but certainly women who are having their first baby, it's not uncommon for us to be with them for much, much longer than 6 hours. That initial postpartum visit is a comparison between, in a hospital-based practice, typically there's rounding in the hospital, so that's usually pretty quick. What we do is, this is the time that we're spending, the provider spending with the woman here in recovery, so we never leave the birth center before 2 hours postpartum. And then, oh, I'm so sorry, that's wrong. That initial postpartum is actually our follow-up visit, our home visit. So that's at a 2 to 4 day home visit. So that typically takes about 2 hours that we're doing that home visit. We also have, in that early postpartum period here in the birth center, we are here with our clients as well. Then we also see our clients back for a 1 to 2 week postpartum visit. So that visit's also scheduled for a 60-minute visit. Most medical practitioners are not seeing women back who have had a normal vaginal birth. And then again, we're doing a 4 to 6 week postpartum visit, and we schedule that for 60 minutes. So this is just, a comparison, just showing how much more time we are typically spending with our clients than what you may see in a typical medical practice. So this is general birth center model of care that I'm going to go into, and then after that we'll kind of go more specifically into Sacred Roots and exactly what care looks like here in our facility. But the birth center offers a home-like facility, again following the wellness model of care. Birth center model of care is very cost effective. We definitely focus on safety and appropriate medical intervention. There are absolutely times that medical intervention is needed, and it's our job to recognize when those times are. Again, woman-centered and family-centered, and the 5 Ps we'll go into: people, place, program, practice of midwifery, and part of the system. So the people of the birth center, of course, the women coming into our care, so healthy women who are anticipating a low-risk pregnancy and birth. Licensed qualified staff. So for us, that means our providers are all nurse midwives, and all of our birth assistants are registered nurses who have labor and delivery experience as well. Understanding the scope of midwifery care. So we do have a very specific scope of practice. We are absolute experts in normal. We can certainly work into things that are moving outside of normal, but especially when we're talking about out of hospital birth, we're working with a normal low risk pregnancy once again. And when things become more high risk, then that's a point where we're going to be transferring care into a hospital-based practice. We do have professional liability insurance and qualified consulting providers. So those are our physician colleagues who we are able to consult with. Again, the place is a home-like environment. The goal is to have a maxi home, not a mini hospital. So we absolutely have emergency equipment here, but it's kind of tucked away. It's not something you're going to see just walking into our facility. Safety, of course, we meet all of the local construction, fire, health, and safety codes. We are also regulated by the state, so the state has, the State Department of Health has had to sign off on everything that we do and we offer here. Equipped to provide routine care and initiate emergency procedures. Birth centers are freestanding, but close proximity to hospital care with access to an operating room. Part of the program of care is an orientation session, so that if you're following us on Facebook, you, I'm sure, see that we have orientation sessions pretty frequently. We offer those 3 times a month. We do Thursday evenings and Monday mornings. 3 occasions per month. So those are orientation sessions where we have clients or potential clients. They haven't necessarily signed up for care, but they're interested in what we're offering here. But it's an opportunity for us to present the model of care, talk about midwifery care, and we also do a tour of the facility, which includes looking at safety features of the birth center, and that's, again, all mandated within the birth center model of care. Informed consent, antepartum care with continuous screening by history, physical exam, routine lab tests, and counseling. So again, when we talk about out-of-hospital birth being safe for healthy women with normal low-risk pregnancies, we determine that with that continuous screening. So that's something that we're doing at every single prenatal visit. We have a list that we actually look at every visit just to make sure that there hasn't been a development of any new risk factors that we might then make a recommendation that this birth might be safer in a hospital-based practice. Family members are always welcome in our care, so that is both in our office during office visits. Women are welcome to bring whoever they like to any prenatal visits. Same thing for labor and birth. There's no limit to how many family members or friends a woman can bring into the birth center. It's her baby, her birth, and so yeah, we have a comfortable, we'll look at that a little bit later, but a comfortable family room, so there's plenty of space for family members to be present. Educational program, we're going to go into that a little bit more as far as what that looks like here at Sacred Roots. Making a plan for payment of services. That's one thing about the birth center model of care that, again, is really it's part of being a birth center, is making sure that our fees are very transparent. And hopefully that's the way that all medical practice will go in the future, because right now it can be really difficult. I'm sure you all know that if you try to, call a hospital and say, how much is this going to cost me? You kind of get the runaround, but that will never happen at the birth center. We're always able to tell you this is exactly what you will owe. And then, or exactly what we're charging, and then your insurance will come into play. And then 24-hour telephone access to the care providers. So someone is always on call and clients are always able to reach their provider. And then, so intrapartum care with a midwife who's in constant attendance during active labor. Postpartum and newborn care is supervised by either a registered nurse or a midwife. We complete all of the required newborn screenings, plan for newborn health care, either here or referring to a pediatric provider. We do the home and office visits for postpartum and newborn follow-up, and we do have provision for support in parenting and breastfeeding. So, practice of midwifery. So we are primary care providers. Again, we believe that pregnancy and birth are natural physiologic processes. We believe that pregnancy and birth are normal until proven otherwise. So we do absolutely recognize that problems can arise, but until those problems arise, we're going to assume this is a normal process. Prevention of disease and promotion of health, and then we do anticipate that our clients will take individual responsibility and be self-sufficient in accessing education and support as they need those things, and then taking a systems approach to health service delivery. So we do triage our clients if there is a departure from normal, making a decision about what the appropriate next step is. Is this something we can manage within our space or our office? Is this something a woman needs to go to a hospital for? Is this, you know, we need to make a referral to another provider, whether that's an OB or, you know, hematology or cardiology, who's the appropriate person to make that transfer to or consultation with. And so that's something we're able to do. And then referring out as necessary. So we do have an interdependent relationship with us and other acute care services. We definitely had written policies and procedures. I spent months and months and months on those, and also making sure that we have strong quality assurance program here at the birth center as well. Relationships with other community health agencies, and we're always able to access referral and transfer to other levels of care should that be necessary, and also access to acute care and obstetrical newborn units as needed. So moving into Sacred Roots, specifically in our program of care, we've kind of covered a lot of this as we've gone, but we'll go over it again. So our program of care for the birth center specifically is prenatal care, labor and birth care, and the postpartum care. So that initial visit, once again, is 90 minutes, allowing lots of opportunity to really talk with our clients, do that full risk assessment, review any previous records that they might have, and then we do a 60-minute visit for the second and 36-week visits, and then 30 minutes for each subsequent visit. Labor and birth, we are with our clients throughout their active labor. We do have registered nurse birth assistants who are always present for the birth. And then our clients have access to the facility from the time of their admission. And then typical discharge is about 4 to 6 hours after birth. And then postpartum, again, we're doing that phone call on the first day postpartum, a home visit on day 2 to 4. During that visit, we're able to do the metabolic screening that's required by the state, and then also for the newborn. And then 1 to 2 weeks postpartum, we are seeing our clients back here in the office, and again at 4 to 6 weeks postpartum. And then of course more often as needed, and our clients also of course have phone access to us at all times. We do have a lot of education here at Sacred Roots. It's continuing to grow. We're excited about it. We do have a comprehensive childbirth education course, Thoughtful Childbirth, that we teach here at the center. For our clients here at the birth center, that is included in their program of care. So childbirth education is part of the fee that our clients are paying. So that's a 3-class series. It's broken up into the 3 separate classes. The first class is really like the physiology of labor and birth, what's happening to the body during labor and birth. The second class is focused on comfort measures during labor and birth. And then the third class really focuses on that early postpartum and newborn care. So that class is available to anyone in the community. There's a fee for anyone who's not our client, but again, for our clients, that's included. And then additional classes that we have here at the center, we do offer a prenatal wellness class, a postpartum wellness class, a sibling preparation class, which is really fun. That class is a 2-hour class. The first hour of the class is really preparing siblings to be a new big brother or sister. What's it going to be like to have a new baby in the house? And then the second hour of the class is for the sights and sounds of labor. So siblings who maybe will be present at the birth, which we do have a lot of siblings present at birth. And so that just helps prepare them for the things they might see and hear during labor. We do have a best breastfeeding class, and then also a postpartum support group and drop-in breastfeeding clinic happening here at the center. So lots of fun things happening here. All of our classes are available to the community, so you do not have to be a like a client at Sacred Roots for these classes. So risk assessment, we talk a lot about risk assessment, again, because out of hospital birth is safe when we are talking about low risk healthy women with low risk normal pregnancies. So the way we determine those risk assessments are both from the standards for birth centers, and then also the Indiana state regulations gave us very clear guidelines on risk factors and what clients are appropriate for our care and what clients are not appropriate for our care. I will say there are some issues with that because it hasn't been updated for, I don't know, probably 20 or 30 years. So sometimes we kind of scratch our heads and go, I don't know what they mean by that. But all in all, we are able to have a pretty clear-cut guideline in terms of who's an appropriate candidate or not for our care. And again, as I mentioned before, we're doing that assessment at the initial visit and then ongoing throughout the end of care. We do chart reviews. So we sit down together and do chart reviews for women typically after the second prenatal visit, and then again in the third trimester we're doing a chart review. Victoria and I do those together, reviewing anything, just making sure, again, that's part of our quality program, so making sure that we've done everything that we intend to do with each client, especially regarding education, making sure all of the information is complete within their chart, making sure we haven't missed any lab tests that may be important for any particular woman. And then also we do chart reviews with our medical director as well. Once a month we meet with him. So any clients who do have any risk factors. So there are risk factors that don't risk women out of our practice. It's more an awareness, okay, this risk factor exists, and then there are risk factors that actually risk women out of our practice as well. But so doing those chart reviews with our medical director. And then that, of course, involves the consultation as well. With him, we're also able to consult with other medical providers in the community as well. Transfer of care, I mean, there are several times that we can transfer care throughout the course of a woman's care. So prenatally, there may be times that we need to transfer a woman out of care, so that could be earlier in pregnancy. And so in that situation, we are helping the woman locate another care provider who may be a good fit for her and helping her to make that transfer of care. And then also, you know, maybe later in pregnancy, there are times we may need to transfer care, you know, once a woman is termed, but maybe not in labor yet. So she may come into the office and she's, you know, 38 or 39 weeks and her blood pressure is really high, and, you know, we do more of an evaluation than just taking one blood pressure typically. But anyway, through our evaluation, we determined maybe she has preeclampsia. That would be a reason that we would transfer her out of our care and move into a hospital-based setting. But transfer of care during labor, the majority of the time, those transfers are not emergent and we're able to go by private car. By and large, our number one reason for transfer is a first-time mom who just has a really long labor and needs pain management or medication. So that's our number one reason for transfer. So, you know, in that situation, we have a stable mom, we have a stable baby, we're able to just get in our cars and move into the hospital setting. So it's very rare that we actually need to call emergency services. National statistics say less than 2% of the time birth center transfers are emergency transfers. Our overall practice transfer rate, and this is more than just the birth center, we do have a home birth practice as well. But our overall emergency transfer rate is less than 0.5%. So when we transfer care, I'll speak to this a little bit as well. We do have a woman's full prenatal records. We print those out at 36 weeks. So we are able, when we make that transfer, we have a woman's complete prenatal record, all of her labs, all of her ultrasounds are printed out and ready to go, because inevitably, if you quickly need to access a fax machine to send records, they never work. So we do print all of those out so that we're able to take those with us. We do go to the hospital with our clients. We are with them through their labor in the hospital, with them through the birth, and then we continue their care postpartum as well. Billing and insurance. So the way billing and insurance works is similar to what you would see in more of a medical-based practice. So in a medical-based practice, you would have a doctor's office that charges their fee, and then the hospital charges their fee. So that's the same way we're set up here at the birth center. So we have a fee for our professional services, and then there's a separate fee for the facility, and that allows us to bill insurance. The way insurance works with pregnancy is date of service billing. So there is a global fee for prenatal care. So we are not actually able to bill the insurance company until the date of the birth. So what we do is look at a woman's insurance and determine an estimation of benefits, and using that estimation of benefits, create a payment plan so that the family will prepay the amount that they are anticipated to owe for the pregnancy and birth, and then we bill the insurance company on that date of service. At this point, we are out of network with all insurance companies. We get a lot of questions about that. The reason for that is it just takes a while to negotiate to be able to go in network. We have to show, number one, women are using our services and it's worthwhile for the insurance company to become in network with us. And we just need to be able to show, yes, we are saving money for the payers and for the clients. And it just takes time to have enough data to support being out of network or being in network. So I know that at least Auburn Birthing Center, where I did my clinicals, hopefully they don't mind sharing, or mind that I'm sharing, I know it was about 18 months before they were able to go in network with any payers. So we anticipate that we will be able to do that in time, but it's definitely something that does take some time. Right now, they want to pay us about 40% of our fees, and we haven't jacked our fees up to be able to say, sure, we can take 40%. And we do have self-pay clients as well, and unfortunately, we're not able to accept government payers at this point, just because the rate of reimbursement is so low with government payers. So what our fees cover, like I said, there's the two separate fees. They're the professional services, so that includes all of the prenatal care, us attending the birth, and then that postpartum care as well. The birth setting includes that orientation session that we do, then use of the facility, and the prenatal education and birth classes, and then the postpartum care are registered nurses attending the birth. All of the routine supplies and lactation support are all included in that birth setting fee. So things that are not covered in our fees are lab services. So we order those labs, but then it's an outside facility that actually draws and processes those labs. So it's going to be the lab that charges for those services. And then ultrasounds, again, we're able to order ultrasounds, but it'll be an outside facility that does the ultrasound. When non-stress tests are needed, there is an additional fee for that. Our other classes, other than the childbirth education class, there are additional small fees for those. And then non-routine labor and birth supplies. So things like RhoGAM is not something that every woman receives during her pregnancy or postpartum period. So that's something that there is an additional fee for, or if a woman requires antibiotics in labor, then we're charging a small fee just to cover the cost of that antibiotic that we've acquired specifically for that woman. So this chart, I think, is interesting. It just shows the affordability, I think, of the birth center. So this comes from mycareinsight.org. So that's a website that you can get on and play around with. It is kind of, I don't know, I think it's fun to dig around and see what different hospitals are charging for different services. So it's certainly more than just birth and newborn care. But so just a few local hospitals, and these are what the hospitals have charged as reported by the Centers for Medicare and Medicaid. So this again is facility fee only. So our facility fee is $4,000, and so that's going to cover the cost of both the birth and care of the newborn. So you can see we are about a quarter of the cost of local hospitals. So again, this is where birth centers are very affordable. So we'll start kind of a virtual tour of our birth center and what it looks like. Our birth center is 5,000 square feet. We do have separate office and birth center space. So this is just in our lobby as you walk in. Those dresser drawers are full of business cards from all kinds of providers in the local area. So doulas and chiropractors, massage therapists, other types of therapists. Every single one of those drawers is full of local providers. We do have 5 exam rooms and 3 adjunct provider offices within our office space. So additional providers other than the nurse midwives who we have in those offices at this point are Kristen Hartwell has a chiropractic office here. Kara Milan offers massage services. April Ryman is a nutritionist here in our center. And Nicole Van Klompenberg is a lactation consultant. So we love having them here in our space. The birth center does have a family room with a kitchenette, a family restroom. We do have 3 birthing suites. Each of those has a jetted spa for hydrotherapy and water birth, and also each birth suite has its own bathroom with a stand-up shower. Here's our family room. It's hard to get good pictures and good angles in here, but kind of behind the couch, there's a children's play area. So again, children are welcome in our space. We have soft blankets to wrap up in. We have television. We've got cable and Netflix on the TV so that family members can really make themselves comfortable while they're waiting for the baby. Here is our lobby. So when you first walk in, this is the lobby. Our first birth suite is the Linden room. So again, very home-like. Each of those drawers is full of medical equipment. The ottomans to the side have supplies in them as well, but those are things we just pull out as we need them and keep the rooms hopefully very comfortable for our clients and families. Sassafras room. So each room has the same amenities, they just have slightly different decor. So our families are welcome to decide, which room feels most comfortable for them. And then when that woman goes into labor, then that's the room that we'll prepare for her. And then Poplar Tulip is our 3rd birth suite. And I think that's all I've got. I'm looking forward to your questions.
All right, thanks everybody. Let's see what we've got for questions. Got to get our okay, hold on. Sorry. Hi, don't go anywhere. We're gonna do some questions here in a sec. Okay.
All right.
Here's one for you. If I live in Ohio, is this something I can take part in, or do you know of something like this in Ohio?
What area of Ohio?
Uh-oh.
There are definitely birth centers in Ohio.
Okay.
So I don't know how far you are from Indianapolis, but certainly birth centers have a pretty big draw. Before we were open here in Indianapolis, there were women driving from Indianapolis up to Auburn to have their babies. So certainly birth centers bring women in from wide areas. So certainly you could come here. I'm not sure how your insurance would work. That would be a question to see if they're going to cover within Indiana, but there are definitely birth centers in Ohio.
Let's see. Oh, she says she's about 1.5 hours away from Indianapolis.
Yeah, so I mean, you're definitely in our range within that hour and a half. Again, the question would just be, I doubt the insurance would be an issue, but certainly that's in our range.
Okay, and it's the next question is, are you affiliated with a certain, sorry, oh, wait. So the person in Ohio, did I tell you 1.5? I'm getting myself together here. Sorry about that. Let's see. They love the concept of sacred roots.
Thank you.
And it says, are you affiliated with a certain hospital if I need to be hospitalized?
We are not affiliated with a certain hospital. We are independent. So in case of an emergency transfer, Methodist is our closest hospital for an emergency transfer. So that's where we would go in an emergency. In a non-emergency, that's something, again, we have an individual conversation with each client. Certainly if clients have, if their insurance says they have to go to a certain hospital network, that's something that we're able to arrange, of course, in a non-emergent situation. But in an emergency, we're going to go, to the closest hospital.
The closest one. Here's another question. What is the average cost of services?
For our birth center services here at Sacred Roots, and I'm assuming by services just meaning pregnancy and birth. So our professional fee is $4,000 and the birth setting fee is $4,000. So the entirety of services is $8,000.
Okay.
And of course, that is submitted to insurance.
All right. So you just kind of gave this answer. Is there a cost for the classes to those who attend, whether they are a client or an outside guest? So you said it's sort of split into two parts.
Correct. So we have the childbirth education class. So for our clients, the 3-part childbirth education class is included in the fees. For anyone who is not a client of Sacred Roots, that class is $250 to attend that class. And then our other classes, I think they're all $40 per class. And that would be like per couple, per family, the $40.
Okay.
With the exception of our, the postpartum support group is free, and then the drop-in breastfeeding clinic is by donation.
That's great. Okay, here's another one. Are the hearing screen and pulse oximetry provided as well?
So we, at that home visit, we're able to do the pulse oximetry. We actually just purchased hearing screen equipment. So as soon as either me or Victoria have a chance to escape to Nashville, Tennessee, we hope to be able to bring that hearing screen equipment back here. And so hopefully we'll be able to offer that soon within our services. Right now we refer the hearing screen out, but hopefully that'll change within the next couple of weeks.
New question, are there RNs on staff that are also IBCLCs?
None of our RNs on staff are IBCLCs at this point. We do, Nicole Van Klompenberg, as I mentioned, is here in our center, and she is an IBCLC. And then also we work a lot with Lisa Leahy, actually teaches the best breastfeeding class. So we are certainly all very experienced with assisting with breastfeeding, and we're able to assist with most breastfeeding concerns. But of course, if there's a bigger breastfeeding issue or concern, then that's when we consult with the lactation consultants and bring them in as well.
Right, right. Right now, I don't see any more questions. So I'm going to give it just a minute or so, because sometimes people think, I think of this, I want to ask it. But also, we can, if folks do think of questions later, they can certainly email us, and we would forward those questions on to our contacts at Sacred Root, and then to Angela and Victoria. And I believe that there's also contact information. I mean, it's easy to find Sacred Roots in Google. So that, which is what I've done a bunch of times when I've had to get your specs. So there's ways to get in touch with these folks.
For sure. We have our website and we have our Facebook page. So we do try to keep those updated with anything that's happening here, and our classes to keep those updated as well.
Are you, I would like to ask a question myself. This is Julia again. Are you all, if you had a client, and I know that that's part of what you want to do, stick with your client and go into the hospital with them. Do you find that the hospitals are, I don't know how many times you've had to do this yet, but do you think by and large hospitals are open to the help that a midwife would bring in, because you're coming from a birth center into the hospital for a particular reason? How does that dynamic go?
Sure. Yeah, no, our transfers have all been very, very friendly. Again, it comes down to the quality of the transfer. Again, we're very safe practitioners. We are, again, risking women out very carefully. If there's a reason for a transfer, we're recognizing that early. So we're transferring women into the hospital at appropriate times, not waiting for something really bad to happen, recognizing early on, like, wow, this is happening and we need to move into that higher level of care environment. And again, just by giving a thorough report to the receiving provider, and also having the complete prenatal records, it goes a really long way in that friendly transfer. And yeah, we've never had any issues. Again, we're not stepping on toes when our clients are very clear that when we move into a hospital environment, we are transferring care. We are there in a support role. We are no longer the client's provider. They have new providers. So our job in that point, upon that transition into the hospital, is to just be there to support our client, to make sure that they understand, decisions that they're making, or if they're presented with options, to help talk through those options with them, and just making sure they feel really well supported within that transfer. But our transfers go very well. We've never had any issues at all whatsoever walking into any of the area hospitals.
That's great. That's great. New question. Do you work with moms that are fearful of the entire process and needing extra support and reassurance?
I mean, yeah, absolutely. I think that's a lot of what we do in some ways, because, I mean, again, that's just where we really have the opportunity to sit down with every client and have those longer visits. We're really able to talk through and really create a strong relationship with our clients throughout their prenatal care.
Right, right. Let me ask you about my understanding is that there's a midwifery program at the University of Indianapolis that is shutting down. So tell me how the process of getting trained staff and getting trained midwives into the system, so to speak, how does that kind of ebb and flow?
Well, for our birth center specifically, I don't know how much I can speak to that, because until very recently, it's just been Victoria and me. But in terms of like, are you asking like if we were going to be hiring more midwives?
Well, I think my question is more kind of on the state of making sure that there are enough midwives to provide services, and are you being supported by the system in general, and by the educational institutions?
Wow, that's a difficult question. Yeah, I don't know that I specifically feel well supported by any systems within our state other than our local community, I suppose.
Right. That makes sense to me.
We definitely have a supportive community, but a lot of times there's certainly many people who have paved this road before us, but we're continuously paving this road.
Yes, right. It's not an easy road in our state for independent providers like you. Yeah.
Not by any means.
That was a very diplomatic answer. Good job.
Thank you.
Well, I think that we're about at the end of our time. We're so appreciative of what you've told us today and being willing to give us this information. Again, if you have more questions for the midwives at Sacred Roots, and you can feel free to email us here at Indiana Perinatal Network. And again, we're so grateful for you giving us the presentation today, Angela.
Thank you so much for having us. It's
okay.
Great.
Well, you're great. Thanks.
Oh, thank you. Have a good day.
Thanks, everybody, for coming.